Dr. Mary Sullivan is a nurse practitioner who works in the surgical oncology division. She keeps Dr. Whalen, myself, and Dr. LaFamina, our new pancreas surgeon, on track. Maybe we're not on time, but we're on track. As I mentioned before, Mary is absolutely a wealth of knowledge. Every time I'm in clinic with her, I learn something new. She then tells me I can go home at that point in time, but I never seem to get out. Mary's going to talk to us today about exercise in cancer, and there's a lot of really interesting data that's coming out that exercise can actually help not only improve people's quality of life and their health, but even possibly prolong their lives with cancer. So if you're talking about alternative options, exercise is one. Thanks, Mary.
Thanks, Laura. One of the new paradigms in cancer, the American Cancer Society, the American Institute of Cancer Research, which is an annual conference that I go to, and Washington, D.C. have been pushing, is the change in the use of the term cancer survivor. We now believe that a cancer survivor is any individual who's had a cancer of any type, current or past, from the moment that you're diagnosed. And one of the facts that came out at last year's conference is that 85% of all cancers occur in people over 55 years of age. It tends to level off at 100. So as we're living to be older, I think if we can get to 100, our chances decrease. The key to longevity is part of survival. First you have to get through, and I think Doug and Lindsay described it beautifully. First you have to get through your treatment, then you have to get past your treatment, then you have to figure out how to keep going on. In other words, once you survive all of this, then you're like the rest of us and have to continue all of the healthy lifestyles. Wellness is what we talk about, and the definition of wellness is the ability to be healthy despite your cancer diagnosis. There are two different areas then, wellness and well-being. Wellness being the physical aspects, exercise is one of them, that's what I'll focus on, and your overall health, and well-being are the mental aspects, your social relationships, your emotional relationships, your spiritual relationships. Both of these areas are affected by each type of cancer treatment, and we generally use surgery, radiation, or chemotherapy in most. Appendiceal cancer patients don't see as much radiation, other than from the CAT scan, as Dr. Kim pointed out, as the rest of us. So what does wellness involve? The areas of physical, social, emotional, spiritual, and intellectual. In the interest of time, you can see I'm going to try to skip along to just the exercise pieces. In order to be physically well, you have to get enough sleep, you have to get adequate nutrition, you need the right amount of physical exercise, you need a moderate use of alcohol and caffeine, neither is completely excluded, avoidance of nicotine and drugs other than those that people like Dr. Switzer give you, and an avoidance of overexposure to the sun. I don't want to see you back as a melanoma patient. What is exercise anyway? Wikipedia, which is the new way we find all of our definitions, calls it any bodily activity that enhances and maintains physical fitness and overall health and wellness. There are 4 types of activity that we can have. Transportational would be how you get yourself places, be it walking, be it standing on a train, sitting on a bus. Household is anything that we would do at home, usually involving the types of chores that we have living at home. Occupational would be that which you do associated with your job. And recreational would be that which you do for fun. There's a significant difference between sitting at a movie and rowing a kayak. Sedentary behavior is the thing that became a really big item at last year's conference. And this conference usually happens in December, so I'm very interested to see what the outcome will be. What the data that they presented last year were that Americans sit 70% of their day, and that includes 9 hours of a day at work. The average American has a 40-minute commute to their job where they're sitting either on a train, a bus, or in a car. They spend even jobs that used to be stand up and walk around jobs. With the advent of technology, so many office jobs, even, I've lost the word. Factory-type jobs have become computer-driven. People aren't jumping up and down at their machine anymore. It's all done in a computer. So you spend 40 minutes getting to work, you sit in your space for 40 minutes, you get up for an hour for lunch, 4 hours, you get up for an hour for lunch, you sit in your space for another 4 hours, and then you do that another 40-minute commute home. And you add to that, the average American spends 6 hours in front of their television at night. That 70% of our time doesn't even include our evening behaviors. What does sedentary behavior do? To be on bed rest for 5 days only has negative things for our body. It increases our body fat mass, which tends to then concentrate on our abdomen, which is the worst place for our heart. That causes our systolic blood pressure to rise. The systolic blood pressure is the top number in your blood pressure. It increases your cholesterol and triglycerides, which cause you other heart problems. And it increases insulin resistance, which causes an increase in the body fat, which starts this whole cycle over again. Exercise is the only thing that you can do that will improve all of them. What else can it do for you? It can improve the way you look by toning your muscles, getting rid of the wrinkles in your face. It can strengthen your muscles, improve your flexibility, and make everyday tasks easier. It can increase your strength and endurance. It can help regulate bodily functions. It's about the only thing other than drinking liquids that any of us can do that helps with constipation. It helps with the peristalsis of your intestines and keeps things going. It can reduce your stress and lower heart rate and blood pressure. And when we exercise, we release endorphins, which helps us to feel better, but it also has been demonstrated to decrease our pain. Exercise is a prevention. This was information that was presented 2 years ago that really last year part of it blew me out of the water. One of the things that they presented at the start of the conference is that we all know that the number one killer in the United States is heart disease. The number 2 killer is cancer. 5 years ago, cancer moved up to number 1, but it's moved back. But in cancer survivors, the number 1 killer is also heart disease, but statistically, it's higher than the population as a whole. And when I have this discussion with the patients, and I see many people I've had this discussion with sitting in front of me, what I say to them is, I can understand that. I've been a nurse a very long time, and years ago, we gave all the chemotherapy in the hospital before we had Zofran. And when patients would get sick, we would have them eat whatever we could get them to eat. So all the ice cream and cheesecake you could have. And then when you survive your cancer, we don't go back to those old behaviors. So of course, we don't take care of the heart. The heart is a muscle. We need to exercise it. The reduction in the risk of dying in cancer survivors range from 18 to 67% with regular exercise. The highest incidence was in colorectal and breast cancer patients. As we've seen throughout the conference this morning, the numbers of appendiceal are very low. So what we do is extrapolate. It's so close to the colon, I try to encourage people to follow the colon data in those kinds of avenues. The recommended exercise is 60 minutes or 30 minutes of walking 5 days a week. In colon cancer patients alone, there was a 50% reduction in cancer and 30% reduction for everybody. I have some of the slides that I'll show you, but the other data that came out in both colon and breast cancer patients were even the people that presented at stage 4, the people that exercised while they were getting treatment, and that's just that 30 minutes of walking every day, had a better response to their treatment. They had a longer time to their recurrence. So it's a significant difference. The preventability estimates, I don't see from the back that you can see these very well, but they presented them from 4 countries. And in the United States are on the left. I want you to zoom down to colorectal, 45%. So half of colon cancers. I don't know what H. pylori and the other things are going to turn out to show us for appendiceal, but certainly if the colon data is similar, these are the reasons that we need to keep moving as a country. 35% for all cancers combined. This is just, I was taught by nuns growing up, and everything was 3 times for the normal mind, so I'm giving you all the same information multiple ways so that you will leave here knowing you need to move. In science, they do everything based on recommendations and the strength of evidence. And so the strength of evidence is very strong that 30 minutes of walking, brisk walking 5 times a week, will lower your risk of early death, heart disease, stroke and high blood pressure, type 2 diabetes, which is the one we get as we get older from having that big belly and that increased abdominal fat. The name for that is metabolic syndrome. Colon and breast cancer are affected by our exercise level. Weight gain is pretty obvious. Falls as you get older. The more that we exercise and the more that we move around, the better sense we have of our center and reduce our risk of falls. It releases the endorphins that help us not to be depressed, and loss of function. There's only moderate exercise for better function in everyone, but I've shown you those slides. So when you're thinking about an exercise program, You need to think about the parameters of how frequent, how long, and how intense. Again, 30 minutes, 5 times a week for heart health. The heart is a muscle. If you exercise, for those of you who I spend all my days trying to get you to take in more calories, you will be more hungry. It also decreases the inflammatory response. And if you look at science, we believe that what cancer cells are normal cells that for some reason inflammation gets turned on and the DNA gets damaged. And as we heard earlier, so when it replicates as a funny cell, and then it keeps replicating. Exercise is one of the only things you can do to help with that. It also improves fatigue. It improves fatigue for those of us that work too hard, for those of us that work too long, for those of us that have surgery, for surgeons who stand at that OR table for 14 hours a day, and for those of you that are receiving treatment. This is a very interesting slide they presented last year on the proportion of cancer survivors who meet that recommended 150 minutes is 30 minutes times 5, for those of you that don't remember school math. And you can see nobody even makes it to 50%, but right smack dab in the middle of the colorectal, which we're going to call ourselves, only a third of people after their treatment meet the daily recommendations. And it's not even 7 days a week. So now I want to give you a little test. This is the current fitness level test. I know it's a busy slide. I will read it. This is how you're going to give yourself points. If your answer to my question is rarely, you take 1. If it's sometimes, you take 2. If it's usually, give yourself 3. And if it's always, give yourself 4. Now, I see some of my patients do not have pencils in their hands. Okay. I find it easy to walk up or down 2 or more flights of stairs. Rarely or always. I have no trouble taking out the trash. I easily do such chores as vacuuming or dusting. I can do other sorts of housework on my own without difficulty, and I don't need help from my family or friends with daily activities. Now the mood and energy level we add to that. I feel younger than my age. Rarely is 1, always is 4 points. I feel independent. I feel energetic. I live an active life. I feel strong. My arms and legs work as they used to, and I am as active as other people my age. I'll give you 2 seconds to do the math and show you what the scores mean. 15 to 24 points means you have a very low fitness level. 25 to 34, you have a low to moderate. 35 to 44, you have a moderate. And 45 to above, you're a superstar. So now there are 3 types of physical activity outside of walking when you're ready to resume a workout schedule that you want to consider: strength training, stamina training, and flexibility training. Strength training is also called weight or resistance training. You can use small hand weights, you can use resistant bands, you can use soup cans if that's what you have handy. How do you start? Try doing it 2 times a week, and you want to work all your major muscle groups. The ones we consider are your chest, your back, your legs, your abs, your arms, and your shoulders, and take a day off in between to rest them. Start with 5 minutes and work up by 5-minute intervals or 2-minute intervals if that's all you can handle. Stamina is all about endurance. That's where you use aerobic activity to get your heart and lungs working to increase the oxygen in your body. You, again, try to do some type of aerobic activity 5 or 7 times a week, working at a moderate or vigorous level, and I'm going to show you how you do that. Flexibility keeps your muscles from getting stiff. It maintains and improves your range of motion. Stretching exercises, yoga, Pilates, those kinds of things are all things you can do at home you don't need equipment for. When you're planning your exercise program, this is the mnemonic you want to use: FIT, F-I-T-T, frequency, intensity, time, and type. Frequency would be how often. How often do we want to do something? 5 days a week. Intensity, how intense or difficult it is. This is how you know what the intensity level of your exercise is. If you can sing while you're doing it, it's a light activity. If you can talk, but you cannot sing or hum, if you're by yourself, you may want to just hum, it's moderate. If you need to take a few breaths before you can complete a sentence, that's vigorous. Then you want to figure out the timing. We want to shoot for 30 minutes. You can do it. The studies show that it has the same effect if you can do 30 minutes straight or if you break it into 3 10-minute segments. And again, what I always say to patients is I live in the real world. In my life, if my workout does not happen before I come to work, the 30 minutes together. It does not happen. I work through lunch every day. When I get home at night, my phone starts to ring. When you're first recovering from all of your procedures, sometimes 5 or 10 minutes at a time is all that you can do. But your full-time job is recovering then, so you have the time to do that. When you get back to your life, you need to figure out the way to get that 30 minutes in, so you're not one of those 35% of people that are not doing it. And then the type is which activity you choose. Mixing it up works best for people. This is a picture of from our pamphlet that we have done for our abdominal surgery patients using therabins and ab exercises. Joe Glover, who is here at the back table, is a personal trainer who works with all of our patients at their request. He comes to our GI cancer support group, which meets the second Monday of every month from 5 to 6 over in the ACC building. If you don't feel the need to talk about your issues but want him to help you personalize an exercise program, he will do it. The reason that we did the booklet was patients began to ask what they could do to get themselves back on their feet. And when you have one of the incisions that's involved in a high pack, you can't use your abdominal muscles for 12 weeks. So working the rest of your muscle groups becomes a trick. And Joe has developed a beautiful program for us just using the stuff you have at home. I'll skip the other studies. Although, for those of you that ever need, there have been other studies that have come out this year showing that people that get EPO-alpha while they're getting their chemotherapy and exercise require fewer transfusions. That people that get neuropathies from their chemotherapies that work out have a lower risk of falls because they compensate in other ways. And this is the American Institute of Cancer Research diagram about cancer prevention and weighing the right amount, consuming the right foods, and 30 minutes of physical activity 5 days a week. We'll do questions later.